I do called a bit seat. I don't like the word because it implies the bit is seating in some little special spot. It really isn't. I didn't get all my skull. Let me see if I have the right skull here. I'm going to have to dig into my little bag of tricks. I don't think I have it out. Let me dig in here. I believe it's in one of these cases. Probably. Not the one.
Brian, do you have a thoroughbred skull there?
Here it is.
Brian,
Yes.
do you have a thoroughbred skull there?
I don't know what all of these are from. I'm sure some of them are thoroughbreds. I've actually processed these heads myself, and we won't get into that, but how that is all done. Probably more, it's like one of those too much information scenarios. A bit seat is basically rounding the front, well, these are actually called premolars, the front molar and the bottom one. So when you're using the bit and pulling towards on the cheek tissue to ask the horse to do something, the tooth that isn't worked on, it comes to a point. And it's kind of an unfriendly meeting, with the soft tissue. So your horse is going to pull the reins out of your hands, it's going to raise its head, it's going to disturb its whole positioning, and you trying to get the horse to do what you want it to do. And the upper premolar is the same. So what we do is we round the front, and we smooth the sides, and we balance the molars. That way, any tissue contact with the teeth is a friendly one. So your horse isn't going to fight you. This is the lighter of the two. So I'm going to pass this skull around. What I want you to do is just pretend you're a horse. No whinnying allowed, and no bucking or biting your fellow people sitting next to you.
Can we kick?
Well, a little kick is probably okay. So just run your finger here and just realize that this is what the horse is experiencing. One is nice and smooth and one has a point. And with your hands in a bit of metal, you can do a lot of damage if you pull too hard, if you're heavy-handed, or if the horse pulls its head and there's a jerking on that mouth. And horses, they remember, if they get a bad experience, they start getting paranoid and defensive, and that sets off a behavioral problem. So just run your finger along there, and then you can pass it on to the next person and let the mandible.
The fact that it's sharper on one side, what is the horse feeling? Is it feeling that there's not enough seat for the bit? Is that the idea?
Well, all it is when you're pulling. Now, obviously, when I do a dentistry, I'm doing both sides.
No, I understand.
Yeah, but this is just a nice. There's nowhere that's going to.
Oh, I see. Rounding up so it can
This
slip
is
over
nothing.
that.
Yeah, the bit slips up and over, and the tissue has nowhere to be injured, because they'll ulcerate their mouth and they'll have all kinds of nightmare scenarios.
Bit can move
So when you're done, it's like
Yes.
the smooth side.
Yes, exactly.
How far does the tissue come up? Because we're seeing bone and tooth.
Right.
How far is the tissue up?
The gum tissue is about halfway up between the teeth and the mandible. It's about halfway up. You're going to have gum tissue. And other things to also keep in mind with when you're riding your horses. Young horses have a lot more headaches. When they get really old, they have a lot of problems. But from 2 to 5, they have quite a few problems happening at that time. And then after about 5, and all the baby teeth have erupted, all the baby caps have come out, they have kind of like a peaceful time in their life where, as long as you keep the dentistry going, nothing much dramatic happens. When they get really old, then they have a whole new set of problems that come up. And let me just show you, this is a very young horse, under 2 years old. This little piece of tooth here is actually a developing tooth. This will later be a full-grown tooth of about 3.5, 4 inches. And this one here is a tooth that was in the jawbone but not quite come through yet. When they're born, they only have 3 premolars because their little head's too small to fit 6. So as the head grows, and my miniature skull shows that actually, this is a 2-month-old, only 3 teeth, and there's one getting ready to start coming through. As the head gets longer, another tooth will come out, and a 4th and a 5th and a 6th, and then they'll have 6 in a row.
Now, where are those teeth before they come down when that baby is born?
It's kind of like a,
Up in the skull or something?
it's like an embryonic state. It's like a little developing tooth, and as the head gets longer, this little tooth starts to developing. Yeah, they're down in the cell level, and then it starts to get bigger and bigger. And next thing you know,
Interesting.
it's developing in the jawbone. As the jaw gets longer, the new one starts to kick in, and it's developing as the jaw keeps getting longer. The back 3 are permanent. They don't have baby teeth on the back 3. They only have deciduous caps. I use a lot of layman's terms not to kind of shoot over people's heads. They only have deciduous caps in the first 3, because that's the first 3 they're born with. And
Deciduous, you think is a layman's term?
well,
Depends on the layman.
Yeah, it depends on the layman.
On your
I
group.
always talk to someone who's never had a horse. They just got a horse yesterday and have no clue. I always talk to them, and not to talk to them as they're stupid, but if you assume that they know, then you might be assuming wrong, right? So, and by about the age of 5, all these deciduous caps are gone. The permanents have come in, they're developing in, they push out the deciduous caps and have all permanent teeth. Now things are fairly consistent because most of the teeth are the same. There's not a whole bunch of new teeth coming in, a lot of pain involved. So it's a pretty easy sailing for a while as long as you maintain the teeth. When they get older, the strength of the teeth varies, meaning you may have one tooth that's run out of viable life, meaning it hasn't got a lot of enamel left in it, and the opposing tooth is still looking really good. So then you have two teeth at different strengths, and then you have changes that are a lot more drastic, and they change quicker when they get into I'm talking into the late 20s. What happens there, you get this cupping effect when they get really old, because, if I can find one, use a different skull. Okay, this one has it here. As they get older, they run out of enamel, and the tooth that they have is of a weaker substance. It's cementum and dentin. And cementum and dentin surrounds the enamel, but the enamel is a stronger part of the tooth. So when this tooth is running out of enamel, so it's starting to cup and get all smooth and shiny, where the tooth surface should be kind of flat because there's ribs of enamel inside the tooth, that's the strength of your tooth right there. So as they get older, each tooth is a different strength, and the changes happen much more rapidly. So it's really important when they get into their senior years that you pay a lot closer attention as well. Otherwise you'll have all kinds of problems cropping up quite early. Ideally, the teeth should be done once a year, starting at about 2, or I also say, if you're going to introduce them to a long line younger than 2, you don't want to have their first experience to a bit be a negative one. So I like to get their teeth done before they ever see a bit. So your first introduction is positive. Young horses they can get fearful of something if they have a bad experience on their very first experience. There's also things called dental cysts, which are lumps that form in the jawbone. You can see this one here has got a bulging effect right there. And what that is this tooth right here. It's developing inside the jawbone and it's swelling the bone out. Now as the deciduous cap erupts and the permanent tooth starts going down, the roots will pull away and that will actually shrink. Quite often a horse at about 3 till about 6 may have kind of a puffy looking face on top, especially the more refined headed horses. Or they may have these bumps on the lower jawbone, and I think that one might have some on it. And there you can see that the actual roots pushing there. That's a dental cyst. Horses can be fractious when they have these dental cysts because they're kind of tender in that area. And once the teeth erupt in and the roots of the teeth that were pushing on the jawbone pull away, that all dries up and it actually goes flat again. So you see sometimes on the mandible, this bumpy jawbone, that's all the roots of the teeth pushing down on the jawbone. It's uncomfortable. Some people, they'll have nose bands on their horses, like a cavesson. Well, on a young horse that has dental cysts, maybe that could be causing a problem. So there's things to be aware from a training standpoint that while they're young, there's issues going on. And a lot of people, if a horse is being difficult, they combat pain with more pain by getting a more severe bit. Right. Think, well, the horse is being really silly and it's being difficult and it's fighting me. I'm going to get a stronger bit to get this horse under control. Right. First, the dentistry. Secondly, consider the dental cyst might be a problem. It's going to be kind of obvious. There's going to be swelling and that might be the problem. So anything that might be touching on that area, like a cavesson noseband, might be upsetting the horse. So that gives you a little bit of insight there. And this one here actually shows you the tooth erupted out of the bone altogether. Once in a while that will happen, and that's not a good thing.
And how does it present itself on the horse?
That can be, it can get quite swelled up. It can be, that can be the undoing of a horse. That can actually cause a horse.
What do you do about it?
When a tooth erupts through the bone, you want that tooth to come down as quick as possible. The best thing to do is to actually take it out of occlusion, grind that tooth. So there's no pressure, and it actually erupts down quicker when you take the pressure off of it. It's just a short temporary thing that you do until it's come down, then the bone will grow back over again and repair, and then you leave it in occlusion thereafter. So whenever I have that, that's what I usually do, is take that particular tooth out of occlusion to allow it to erupt back into place, and then the root pulls away, bone repairs, problem solved.
So you say that can stress a horse